Good afternoon, and thank you for everybody who has joined this page for the Facebook live session on endometriosis. As you all may be knowing that March is the month of endometriosis awareness. Endometriosis is a disease that affects many women, up to 8 to 10% in any population, and it is one of the most damaging diseases to affect the female reproductive system. So it impacts reproduction, chances of pregnancy. Usually it results in pain during menses. Many other symptoms are there, but we've been educating our people who want to know about endometriosis through our posts. I hope you've gone through. Today let me start by the questions that have been posted earlier in response to our Facebook live campaign. So the first question is from Pratibha Bai, who's asked endometriosis bhalo kemti hobo, baby conceive kemti hobo. So एटा गोटे बहुत simple question, यार सीधा आंसर दबाटा कष्ट. तांकर रिपोर्ट्स देखिवा दरकार, रिपोर्ट्स देखिवा दरकार, तांकर जानिवा दरकार जे तांकर केते सिवियर एंडोमेट्रियोसिस अछि, आ कौन तांकर असुविधा हेची सिस्टम रे, सेही अनुसार ही आमे ठीक कहि पाइबा कि भलो हबो कि नाही, छुआ पिला रहिबार कौन संभावना अछि, आपे आपे गर्भ रहिबो कि आईवीएफ कि अलगा किछि टेक्निक करिया को पड़िबो. The next question is by Amit, who is asking, I think it is just a statement, there is no question, but he says that my wife had endometriosis grade 4. So grade 4 endometriosis is one of the most severe forms of endometriosis. I am not sure whether they have already conceived, what their issue is, because not that everybody is not able to conceive. There are some people with early endometriosis who might conceive on their own. But that's the most important thing. But grade 4 endometriosis certainly is one of the most severe forms of endometriosis. The next question is, what are the tests for endometriosis? I hope whoever has posted is listening and to get their answers. So what are the tests? So there are not many tests for endometriosis. Normally what happens is that the doctor suspects based on patient's symptoms. The symptoms may be like severe pain during periods, severe pain during sexual intercourse, severe pain during passing a stool or passing urine, and or patient may also come with difficulty in getting pregnant. So the major test that helps us in some kind of diagnosis is an ultrasound. Ultrasound should be very accurate and good, preferably a transvaginal ultrasound. Other tests that may be used rarely is a MRI. Mostly the diagnosis is done by laparoscopy, which is considered to be the gold standard for testing and confirming the presence of endometriosis. Then there is a question by Haneet who asks, I have done one-time endometriosis treatment, will it recur? Now this also is a difficult question to answer because we don't have anything like one-time treatment. It depends on what that patient had. If the patient had one endometrioma, which is an ovarian cyst as a result of endometriosis, and the patient has been treated for that, has been operated, and then she has already probably conceived or wanting to conceive or going through treatment, it is possible that the recurrence may not come back at all. It is certainly possible. But we also know that endometriosis is a recurrent disease, and in the course of one's reproductive life, which is between the ages of 45, 50, it can come back. The next question is, can having PCOS lead to endometriosis? No, if you have PCOS, it does not lead to endometriosis. Neither if you have endometriosis does it lead to PCOS, but very often endometriosis and PCOS coexist. Their causes are different, but they might coexist. The next question is, what is the success rate of cervical encerclage in a bicornuate uterus? Now this is an unrelated question to our issue that we are discussing today. And so my question would be, we will certainly want to know what the cervical encerclage was given for. because bicornate uterus as such is not an indication unless there is cervical incompetence or something like that. So I would say that based on the indication why cervical encerclage was given, it has a reasonably good chances of being successful. Okay, so what other questions are there? Yes, can endometriosis be detected in ultrasound? Yes, the first test that makes us suspect endometriosis is a ultrasound. So ultrasound will usually show chocolate cysts or different kind of cysts or distortion in anatomy of the pelvis, position of the uterus, position of the ovaries. So there are many signs which we can see on ultrasound that can make us suspect and diagnose endometriosis. So can I see the questions here somewhere? So as we have seen, endometriosis is a difficult disease to treat. And it affects quite a few girls and women. My suggestion to all the girls, young girls especially, those who are in college or young adults women who have just got married, planning for pregnancy, especially young girls, they need to know that if you have severe pain during menses, which you feel is different or rather very much more severe than your friends or your peers, your classmates, your friends, then that should be reported. And so doctors are also aware that if somebody goes on coming for menstrual pain, because usually girls get used to menstrual pain and they know that it's part of life, and taking a tablet or two usually helps them. So if young girls should be aware that there are these conditions that can be debilitating and they are long term and they can damage their reproductive system, so they should report severe pain, and even doctors should take it seriously. Amongst younger women, they should be aware that any pain, menstrual pain, which is increasing in severity, like in your young age you never had much pain, and now with age the pain is increasing during menses, that is certainly a reason why you should be seeing a doctor and talking about your severe symptoms. Now there's another question. In IVF, if someone's endometrial thickness is 7 millimeters, can she conceive? Now again, this question is not related to today's episode, but I shall answer it. So usually there is not a absolute cutoff, but 7-8 millimeters is considered to be a good endometrial thickness. So I would say that there is no absolute indication that okay, somebody has 6.9, 6.8, she will not be able to conceive. We cannot say like that. But yes, it will reduce chances if the endometrium is not as much as it should be. Now next thing which I wanted message that I wanted to pass on today is about the surgery for endometriosis. So about surgery, you have to understand that women who want to get pregnant or who are trying for pregnancy, they should be aware that endometriosis is a disease that damages your reproductive system. And so if a doctor advises you any kind of surgery or operation for endometriosis, you must always take second opinion or third opinion, because surgery in endometriosis is highly specialized and skilled. So how, where, when you do the surgery for endometriosis is very, very important. It should be done in skillful hands. Another message that I wanted to pass on is that in today's time, because women are very much into their careers, and that is also fair, because we have to develop our careers before we plan a pregnancy or try to settle down. So what happens is that women invariably sometimes delay pregnancy, getting pregnant. By the time they do a job, it becomes 30, 35, 37 when they are ready to have a family. and that might also increase the chances of endometriosis somewhat. So girls who have endometriosis, they should know that there is an option where their fertility can be preserved by freezing their eggs. So a little bit I'll speak in Oriya also for everybody to understand. Is that बहुत जन झील मैंने अच्छा जो मैंने बहुत यंग एज रु कम बयस रु 18 19 20 एमती बयस रु से मानकर बड़ बड़ ओवेरियन सिस्ट चॉकलेट सिस्ट हो जाए आउ से गुड़ाक बारंबार हुए थरे दिथर तीन थर एमती भी सर्जरी करिया को पड़े सो से मानकर बहुत सिस्टम टा डैमेज हो जाए तो तेमान को प्रेगनेंसी हबा पई असुविधा हुए जेमती से माने 25-30 वर्ष होती तो एमतिया केस रे जो मानकर एंडोमेट्रियोसिस अछि से माने तांकर डॉक्टर सहित एग फ्रीजिंग विषय रे कथा हे परिबे जो थ्रे की तांकर फर्टिलिटी किछिटा परिमाण रे प्रिजर्व करी हबो आ से माने लेटर एज रे छुआ पई चेष्टा करि परिबे. There is another question which says painful and heavy period is one of the cause or not. No, painful period is suggestive of endometriosis. हे पारे कि अच्छी endometriosis तारो जदि बहुत painful होची heavy period भी हे पारे but इटा अलगा रे एकुटिया गोटे endometriosis रो कारण बोली हमें कहि परिबानी. So any further? So these are couple of new concepts that I wanted women to understand, especially about egg freezing. Also maybe our people who are attending today's live session, maybe I also wanted to tell them that usually when the woman is suffering from grade 3, grade 4 endometriosis plus chocolate cyst, that means severe endometriosis, usually they will need test tube treatment or IVF treatment to get pregnant. And there is another thing which is called serum AMH, which is a test to check one's fertility. Usually whenever somebody is diagnosed with endometriosis, we also want to do a serum AMH to understand as to how much their fertility has been damaged. So you need to understand that IVF is one of the main treatment choices for infertile women, those who have not finished their family, who are suffering from endometriosis. सेमाने शीघ्र ट्रीटमेंट करवा उचित. आईवीएफ जदि दरकार पड़ुची, जदि डॉक्टर तांको आईवीएफ पई कहिसंती ताहले आईवीएफ मध्य से माने चेष्टा करिकि जेते शीघ्र हे परिबो सेटा करवा उचित. अन्य ट्रीटमेंट गुड़ाक काम न दे पारे जेते बेले एंडोमेट्रियोसिस अछि. There is another question which is what are the main symptoms of endometriosis? Like I have said, the major symptom is severe pain, sometimes heavy bleeding during period, and usually से pain टा period सरला बेलकु अधिका हुए. period आरंभ रु हल्का हल्का हबो, period सरला बेलकु 4 दिन 5 दिन बेलकु सबुठु बेसी हबो. आउ ता छडा बहुत जनकर जो मानकर गोटे प्रकार एंडोमेट्रियोसिस थाए तांकर मासटा जाक पेन थाए ताको chronic pelvic pain कहंती. So they have some kind of pain and discomfort for a long time or throughout the month in their lower abdomen and pelvis. Second symptom होची से मानकर इंटरकोर्स टाइम रे इंटीमेट हवा समय रे बहुत पेन मध्य हुए. डीप पेन हुए कारण सेटा यूट्रोसैक्रल वाली गोटे टाइप रो लिगामेंट थाए गर्भघर को धरिबा पई. सेथि एंडोमेट्रियोसिस हेले इंटरकोर्स कैन बी पेनफुल. थर्ड सिम्पटम्स होची जन जनकर खूब डिस्चेजिया डिसयूरिया हुए. दैट मीन्स झाड़ा पास कला बेलको while passing stool they have severe pain to evacuate the bladder and sometimes the bladder also. So that can be some of the signs which alerts us, but we try to think कि जो pain टा दिनू को दिन बढ़िबारे लागि छि आउ जियो टाइम रे जोटा एते नथला एबे 20 25 30 आड़ को बेसी बेसी बढ़ुची सेही केस रे हमें सस्पेक्ट करि परिबा और सेटा ही आपण फेस कले आपण डॉक्टर को देखा करबा उचित. what deficiency causes endometriosis? Normally there is no direct link with any deficiency to cause endometriosis. There is no cause and effect with any vitamin. But sometimes it has been shown by some research that antioxidants, जोटा माइक्रोन्यूट्रिएंट जो गुड़ाक से गुड़ाकर डेफिशिएंसी हेले बेले बेले एग्रावेट करि पारे एंडोमेट्रियोसिस को. बट एंडोमेट्रियोसिस यूजुअली गोटे जेनेटिकली डिटरमाइंड गोटे जन जनकर जेनेटिक लिंक अच्छी आउ जेनेटिक प्री डिस्पोजिशन अच्छी. मोस्टली से कारण एंडोमेट्रियोसिस हबार कारण अच्छी हो पारे. ता छड़ा केते गोटे रिस्क फैक्टर अच्छी जे जानिबा दरकार समझते कि अच्छा ए केस रे मते हबार संभावना टिके बेसी. दोज हु हैव गॉट वेरी अर्ली मेंसेस जो मनकर बहुत जल्दी पीरियड स्टार्ट हो जाई 10 वर्ष रे सेमती केस रे जो मनकर बेले बेले किछिटा यूट्रस रो डिफेक्टिव स्ट्रक्चर अछि केते गुडा कंजेनिटल एबनॉर्मलिटीज थाए से गुडा को मध्य गोटे रिस्क फैक्टर. Age is a risk factor. Genetic history genetic predisposition can be a risk factor. Then smoking and alcohol intake, which is causes inflammation in all cells of the body. That also can increase your chances of or at least severity of endometriosis. So केते गुडा risk factors अछि. Delaying childbirth एगुडा को सब risk factor. Then there's another question which has just come in, which is if I had chocolate cyst, I did laparoscopic surgery, how can I conceive naturally? So again it a बहुत simple question होची जहारा मोर पाखरे आंसर नहीं. कारण laparoscopy surgery रे कोन देखा जाइथिला सेटा जानिबा दरकार. अन्य pelvic structures जेमति कि pelvis रे pouch of Douglas हैला, दीटा एक fallopian tube हैला, pelvic side walls हैला, uterus size और shape हैला, ट्यूबो ओवेरियन रिलेशनशिप हैला. तो एगुड़ा को बहुत गुड़ाई जिनस अच्छी जोटा लैप्रोस्कोपिक सर्जरी टाइम रे आपन को डॉक्टर ताको नोट करिवे आउ लेखिकी देबे डिस्चार्ज की इन्फॉर्म करिवे. सेटा देखिले आमर किछटा आइडिया हे पारे कि अच्छा याकर अन्य सिस्टम गुड़ा को भलो अछि कि नेचुरली प्रेगनेंसी रही परिबो कि. किंतु जदि लैप्रोस्कोपिक सर्जरी भलो उपाय रे हे थाए, भलो क्लीन सर्जरी हे थाए आउ पेशेंट यंग थाए, less than 25, less than 30 at least, तांकर ओवेरियन रिजर्व भलो अछि जेमति कि सीरम AMH जोटा मो आगु कहली भलो अछि, ताहले नेचुरल प्रेगनेंसी पई हमें बहुत थरो सर्जरी परे छाड़ी दो. सर्जरी परे नेक्स्ट 1 ईयर टाइम 6 months to 1 year सा होछि सबुटु बेस्ट टाइम जेते बेले नेचुरली प्रेगनेंसी रही पारे. Okay, so I think we are coming close to finishing our time. We have just about a couple of minutes. If there are any more questions, I can take them. So like I said, surgery is very, very important. Good surgery is most important, which of course necessitates that as a patient you talk to an experienced and a proven laparoscopic surgeon to do your surgery, and always take a second opinion before doing surgery. No point in taking second opinion after doing the surgery. And taking second opinion in medicine is very common. It should be done, and all doctors also should accept that and happily accept their patient taking another opinion for any procedure that has been suggested by them. So what else? Another thing, maybe I can also talk about MRI. So because MRI is a mode of testing or investigation which has become available of late in the last couple of years, it is a very expensive test, and usually it's not generally, as doctors we do not prescribe MRI commonly, because majority of the cases of endometriosis can be diagnosed by a good transvaginal, transrectal or a good abdominal ultrasound. Very rarely will you need MRI. MRI may be needed when you plan surgery and you want to know what other vital organs have been affected by endometriosis. So there is something called deep endometriosis which can also affect the rectum. जो रास्ता रे the passage which is the rectum जोटा झाड़ा रास्ता टा थाए सेटा मध्य यूट्रस रे एकदम पाखरे तो सेटा भी अफेक्ट हुए बेले बेले तो सेटा जानिबा पई कि आउ परिस्रा थली जोटा यूरिनरी ब्लैडर ता भितरे अफेक्ट करछि कि एंडोमेट्रियोसिस एगुडा को केतेगुडा फाइन साइंस थाए जोटा हमको अल्ट्रासाउंड रे भलो कि जणा न पड़ी पारे सेटा हमें जानिबा पई आउ टिके डिटेल जानिबा पई हमको एमआरआई दरकार पड़ी पारे नहले नॉर्मली एते एक्सपेंसिव टेस्ट एमआरआई भलिया प्राय दरकार पड़े नहीं. So can endometriosis be curable by medicines? Yes, there are many situations of endometriosis which can be cured or at least suppressed by medicine. खाली एया बुझियार अछि जे endometriosis टा बहुत अलगा टाइप रो डिजीज तेणु बहुत थर ताकू लॉन्ग टर्म सप्रेशन करके रखिया पड़े. जदि आमे ताकू लॉन्ग टर्म बाय मेडिसिन देकी सप्रेस करबानी ताले से बारंबार आउट से बाहरी पारे. So but yes, medicines can cure endometriosis. It depends on what stage and what grade and how much you need, what treatment you need. Pregnancy darkar na khali pain hochi na kon achi. So there's another question I think about TIFA scan. TIFA scan, again this is not related to our session today, but I think the question is यदि TIFA scan late रे करा जाए ताहले किछि लाभ अछि कि किछि प्रॉब्लम अछि कि. सो प्रेगनेंसी रे TIFA scan करियार गोटे कारण अछि सेटा सबुठु इंपोर्टेंट और एक्सटेंसिव अल्ट्रासाउंड जो थे डॉक्टर माने छुआर पूरा डेवलपमेंट देखिया पई चेष्टा करथि. आखि नाक कान जहाँ देखि हबो बहुत रोग बहुत डिफेक्ट्स तो जानी हबनी बट जो गुडा को जानी हबो ताकू जानिया पई चेष्टा करते. आ आपण माने समस्त जानछंती जे 20 सप्ताह भितरे आउ एबे केतेगुडा सिचुएशन रे 24 सप्ताह भितरे ही आमे लीगली एबॉर्शन करि परिबा. सेटा गोटे सरकार रो नियम. तेणु आमे चाहू जे 20 सप्ताह भितरे जदि अल्ट्रासाउंड टा हैला ताहले जदि किछि ताथरे डिफेक्ट बाहरला जोटा कि आमे जो सिचुएशन रे आमे छुआ कंटिन्यू करबा को एडवाइस दबुनी ताहले आमे सेही समय भितरे ही अल्ट्रासाउंड टिफा स्कैन कले जाय कि लाभ हो. सेथ पई कि लेट रे टिफा स्कैन कले जदि किछि डिफेक्ट न बाहरला तो बहुत भलो कथा किंतु जदि हेला असुविधा बाहरला ताहले विशेष लाभ होबो नाही. Then there is another question which says I take cycloreg 10 for 8 days. I try to conceive. Can I conceive through this medicine? No, cycloreg to the best of my knowledge is not a medicine to conceive. You'll have to talk to your doctor more details about it. So I think we are also coming to an end of our Facebook live session today. Thank you very much for joining me for this session. I really enjoyed it. I hope you all also had a good time and I could answer your queries. Stay tuned and stay connected in the future. Thank you very much.